Well, I'm very fortunate this morning to have Rob Schmitt, the CEO at Gibson Area Hospital in Gibson City, Illinois, to talk about electronic health records and the value that they've brought to his organization. Rob, would you like to tell the folks a little bit about Gibson City Area Hospital and the services type of organization you have, please?
We are a critical access hospital, 25-bed rural facility in Gibson City. We have basically every short-term acute care service that a normal hospital would provide. We still provide OB services. We provide surgery services, general surgery, orthopedic, urology, ENT, all of those.
Sounds like a very diverse organization and an appropriate array of services for a rural community. You've been an early adopter in terms of electronic health records and really connectivity between the various diverse parts of your organization. Tell us a little bit how you got started down that path.
Well, it really started with the PHO. Probably 5 years ago, our physicians started talking about the need to be connected together, the need to share information, and actually the need to gather our own quality data so that we could in turn go to managed care companies and share with them how good our quality was and how good our patient care was, and really kind of a pay-for-performance model before pay-for-performance came to be a term, really. And that was the idea behind the medical staff initiating our adoption of electronic medical record. And it was really the medical staff that's been the driver, and the PHO has been the conduit for which we've been able to achieve our early adoption.
As you develop plans to go down that road, as you look back at those now, what were the big challenges for you in this transformation of Gibson City Area Hospital?
The big challenges were staffing from an IT standpoint. We did not realize the kind of IT staffing that you really need to invest on the front end to do a venture like this. The other challenge was, of course, infrastructure. We had done a lot of infrastructure upgrading over the years. We're fully fiber throughout the hospital. We have connectivity with all of our clinics. We have triple redundancy for internet connection through cable and a T1 line, as well as wireless connectivity. So we did a lot of infrastructure. Staffing was a big thing, and then also making sure the physicians bought into the idea of electronic medical record.
Well, and it sounds like your physicians being proactive on the front end address some of that culture question that sometimes can cause some significant obstacles for that kind of change within an organization.
Yes, so our advantage was our lead physician was a doc who's been there for 25 years, could barely use a cell phone, was not an early adopter of IT of any sort in his office or in his personal life, and he was the one who stood up in the medical staff meeting and said, if I can do this, you all can do this too. And he and I had a personal conversation in the early years, and he said, you're going to have to pull me kicking and screaming, but I know you're going to have to pull me, so I'm telling you to do it. But having him at least acknowledge that from the beginning, having him be a leader, really helped the rest of the medical staff step up and say, well, if that guy can do it, I can do it.
What would your physicians say who've been engaged in this process? What would they say has been the biggest benefit to their practice?
Well, it has improved some efficiencies in their practice. I think some of them would argue a little bit about that, because initially it certainly slows you down as you try and go through that process. Sure. It's improved their documentation. It's improved their coding. So they've seen an increase from a reimbursement standpoint in that most physicians will tend to undercode things. They spend 45 minutes with the patient, they give them a level 2. Well, the system says, well, you've met all the criteria for a level 3, and so that's what it bills. The ability to share data internally between our family practice and our specialists, like our general surgeons and our orthopedic surgeons, instead of having to write out a note and send it along with the patient, it's just a click of a button and a transfer of that record over to that physician. Same thing for e-prescribing. What used to maybe take several minutes to write out a prescription, and if the patient's on 5 or 6 prescriptions, you got to write all those out. Now it's 3 clicks of the mouse and a click on send, and it's faxed to the local pharmacy, and the patient can be there to pick it up in 10 minutes. So it's really enhanced their productivity in their office, their ability to share data and to have accurate data. They can see the record, the note back from the general surgeon almost immediately once they make their note and send it back instead of waiting 2 or 3 days or sometimes a week to get it through internal mail, things like that. So that's been a real benefit. And we're working with our medical staff on what is a meaningful quality data to collect. Because some of the things that we collect, they don't really mean a whole lot, even though everybody wants to collect the data. So we still collect it, but it really doesn't tell us a whole lot. So having that ability to get to all the physician offices and all of the patient data and then aggregate that into a graph or a spreadsheet and look individually by provider, long term I think will benefit our patients.
One of the things that I hear frequently, the challenges of recruiting providers to rural areas. And as I talk to physicians who are coming out of residency program, the opportunity to work with an EHR is of significant importance to them as they're making choices. Have you found your front-end status of early adoption, has that enhanced your ability to recruit providers to your area?
It has. They're looking for that. They all use an electronic medical record when they're in residency now. And so that's one of the first questions they ask after how much will you pay me is, do you have an electronic medical record? Yeah. And so the ability to answer yes to that. The third question in that list is, do you have a hospitalist? And our answer to that is yes. And so we're a quick out of the gate 1, 2, 3 with yes, yes, yes. And you can see the physician really kind of become at ease with that those are all in place. Now let's talk about, you know, my work style, my lifestyle, my work-life balance. We've really used that to our advantage in being able to recruit multiple primary care physicians over the last 5 years.
As you look back at this process, what are there do-overs that you say, boy, I would turn left as opposed to turn right here? As you look at this process, anything that you would do over again differently? Absolutely.
One thing we would do over, if we could go back to the beginning, would be hire clinical IT staff from the beginning. Mm-hmm. That would be a nurse, IT person. Now they're rare and sometimes difficult to find. We were fortunate enough to find one last year, and just adding her to our IT department, we've probably gone in a year farther than we went in the first 3 years combined, just based on her clinical knowledge. She could help the physicians through their flow process in their clinic. She understood how the clinic's supposed to flow from a nursing standpoint. Mm-hmm. You know, IT can go in and set everything up and say, here, click all these buttons and here's how the software works, but they don't know how the office is supposed to work. Right. So having that clinical IT up front, making that investment on day one would be critical.
Well, and one of the things that we're seeing from the Regional Extension Center perspective is it's really, and you've made that point very clear, is the difference between, yes, your software is working, and the ability to meet meaningful use involves all of that workflow design, because this practice is different from this practice, and the age of the physician and the staffing, all the other pieces really come into play. And you're right that, you know, technically it works. From a perspective of, and it all works well together, I think is an important aspect, because that's how you really see the benefit of the electronic health records. If your organization was using a paper chart today and you had to make this trip to meaningful use, I think over a 2-year period of time, it would be a significant challenge. And I think your internal awareness of that kind of technology and its uses and the buy-in of the physicians certainly has to make your life much easier.
It does, and again, we've been on this road for almost 5 years now, and so it really was the doctors initially saying, hey, we really should talk together better. We have good quality data. I think there was a national report out on health by county recently, updated. Ford County is 11th in the state of Illinois in overall health. And I know they measure several different factors, but we kind of look at that with some pride, saying, hey, out of 102 counties, we're number 11, so we must be doing something right from an overall health of our community standpoint.
Yeah, and I think those situations, as we think about patients, so if a patient is leaving your hospital to go for neurosurgery or cardiac surgery somewhere, that the benefit of you being able to, in electronic package, send all of the information so that receiving organization is looking at everything that is currently available about that patient they're receiving, has tremendous benefit to your community, and absent the infrastructure that you put in place, that would not be the case.
Correct.
Rob, any other last thoughts that you have about electronic health record and the digital world as you look from your perspective as a rural hospital CEO?
Well, I guess my only advice, to those who haven't started yet or who are just starting would be, don't shortchange the investment on the front end of your staff. I know there's lots of EMRs out there that say, well, we're internet-based and you don't even need IT staff to support. There's an 800 number to call or things like that. And having that person in-house with that knowledge, being able to touch the providers, go to their offices, sit next to them and answer questions, has been a vital asset for us as we've walked the journey together through EHR. And so don't shortchange the front end thinking you're going to save money, because you will spend that 10 times over on the back end trying to fix everything that you didn't get right the first time. And again, I would say a key element of that is clinical IT staff. Even if you have to try and develop it in-house, take a nurse who's interested in computers and good with the software you have from a hospital standpoint, and let them be your clinical person. That's so important from the physician standpoint. And again, in our organization, you talked about culture before. The culture really is a collaboration between the hospital and the physicians, and it actually starts at the board level. Our board has set that as a strategic initiative to be a collaborative partner with our medical staff on all levels. So when you have that kind of commitment at the very top, meaning above the CEO from the board, that is a tremendous asset to help pave the way.